Hello, everyone. My name is Marty Guthmiller, and I am CEO at Orange City Area Health System. And as I say that, I look at all the logos and even on my shirt. And of course, obviously, I'm with Orange City Area Health System. So thank you for joining us today for this community briefing, yet another on COVID-19. I have a couple different items to share with you today. First, I'm going to share just some of the traditional information that I've shared. This is only available now weekly. The coronavirus.iowa.gov website is updated weekly, but it's also updated Monday, Wednesday, and Friday in a different way, and I'll show you that in just a moment. So first of all, some of the information that I've traditionally shared with you. The Iowa 14-day percentage positive rate is 8.9. That is up from a week ago at 8.6 and the week before that at 8.2. The 7-day average positivity rate is 9.0%, 8.6 a week ago, 8.3 2 weeks ago. So both of those measures are up over the last couple weeks. Bringing it a little closer to home, Sioux County is at 14-day. The 14-day rate is 6.5%. That is down a little bit from last week at 7.0 and up a little bit a week before that of 6.0. So pretty constant at 6.5, 7.0, and 6.0. The 7-day is a little bit lower, and that's a good thing. Signals a little better rate perhaps locally, 5.6%, 5.6 for the last 7 days. That's down quite a bit from a week ago at 9.0% and 7.0 the week before that. A little bit of a breakdown of the 7-day is the largest group in that in Sioux County is in the 50 to 59 age bracket at 22%. The 60 plus brackets added together would yield 14%. And then curiosity here regarding schools and what might be happening in schools. The 0 to 17 age group is at 12%. So you know, one of the lower groups in that category. So that's certainly good news. Jumping to Region 3, we have 62 hospitalized currently in Region 3. That is up from a week ago at 52, and 2 weeks ago was also 52. We have 17 people in the 20 counties in Northwest Iowa in the ICU. That is up from a week ago at 13. And these statistics are changing in terms of what's being made available by the state of Iowa. One of those changes is that I do not have the number of folks on ventilators any longer, but 17 in the ICU and 13 a week ago. We're going to talk about deaths a little bit in just a little bit, so I'll skip over that. And then another statistic that I haven't shared, but a little bit of an alarming stat, is that the Iowa bed availability. So the number of hospital beds available in the state of Iowa is at 32%. Now that represents 2,500 to 3,000 beds, but still 32% is a number that is much lower than it's been in the past. And that relates to licensed capacity versus staffed capacity. I assume the available beds is based on licensed capacity, which I know that is not being able to be met in most places. That bed capacity is actually diminished because there is not staff to staff those beds. So we'll keep that number on our radar as well, and we'll look, report that and keep an eye on that as things go along. I mentioned that the site Iowa coronavirus.iowa.gov website does have Monday, Wednesday, Friday updates, and I'm going to share my screen just a little bit here and show you what that form looks like. And you're free to look at that. It's updated every Monday, Wednesday, Friday. And it is called just simply the summary dashboard. And so I'll walk through a little bit of this, but you're certainly able to do this on your own as well. You can see on there that it does have the 8.9% there is the 14-day positivity rate. It lists out the number of hospitalized patients in the state of Iowa. So that's not region 3, it's everywhere. 158 COVID patients in the ICU and 86 admitted in the last 24 hours. So that's that information is there for your own review. 30 deaths were reported in the last week. So that is a sobering statistic again. 6,337 deaths in the state of Iowa is now the total. Again, it's important to remember that 0 of those deaths were under the age of 29. 1% was in the 30 to 39 age bracket. 92% of these folks in the 6,337, 92% are 60 and over. So this has remained and is remaining largely, particularly harder on the older population. Also, and coincidentally, 92% of the deaths are related to or in concert with pre-existing conditions. And so again, very constant throughout this, typically an older casualty effect, and typically one that affects folks with pre-existing conditions harder than others. Some stats we haven't talked about, but that are available for you to look at if you'd like, is 18 plus fully vaccinated in the state of Iowa is being reported at 64.1%, and the 12 plus with at least 1 dose is presented there at 66.7%. Again, so you can keep a track on that if it's of interest to you. The next last 3 numbers I want to share with you are these numbers here at the bottom, and it says those not fully vaccinated account for 88% of the COVID patients in the ICU. So 88% of the folks in the ICU are not fully vaccinated. And it's not 100%. So of course we do have breakthrough cases. Some people still get sick if they're vaccinated, but by far, you can argue with the whether you should be vaccinated or not. You can argue about a lot of different things relative to the vaccine, but really what you can't argue with is how it's being manifested in illness today, on the ground, in the hospitals. I know Sanford had a state a graph the other day that within their footprint, within 22 hospitals that was in this study, they had 19 people on ventilators. 18 of those people were not fully vaccinated. 1 of the 19 was vaccinated. So it does happen. It is out there, but just that one glimpse, that snapshot the other day was 18 out of 19 on event were not fully vaccinated. To finish this out, patients hospitalized because of COVID-19, 79.4% are not fully vaccinated. So clearly 8 out of 10 folks in the hospital with COVID are not vaccinated. Long-term care beds. This is kind of an alarming stat, but you gotta get past the headline with this. On August 16, the number of long-term care breakouts, and the breakouts are defined as 3 or more in a nursing home facility. The 3 or more can be staff members or residents. So that's an important distinction. But that number on August 16 was 3. And so in less than a month's time, we've gone from 3 long-term care outbreaks in the state to 20. That's a significant number. It does not mean that our seniors necessarily are the ones being infected by the virus. It could be, but it also could be staff. The point being that the virus is still very active, the virus is out there, and that preventative measures need to stay in place for nursing homes. So we'll keep an eye on that, but that's a little bit of a shocking number to me. Again, most of nursing home residents today are vaccinated, so they probably are not the ones that are getting critically ill, but perhaps some are, and certainly you can't argue with the 20 listed as outbreak. So I'm going to stop sharing the screen. I just want to make sure that you know that that's available and is out there for your own use. I want to shift gears here a little bit and talk about a couple upcoming briefings that we're working on that I think you'll find very interesting. I hope you do, and if you're not, you don't have to watch. So the first thing is, we've talked about keeping your engines tuned, and when we do that, we talk about fitness, blood pressures, blood sugars, that kind of thing, but we really haven't delved into that very much. Well, we're going to, starting in the next week or so, we're going to do a briefing on diabetes and what, particularly within the realm of COVID, how that's affected us positively or negatively, what's been the impact, how you access our system for services, things that are available, some basic questions about diabetes. And so Dee Meerdink and Olivia Chapman will be joining us for that briefing. And we look forward to that. And if you're interested, stay tuned to our announcements and future COVID briefings, and they'll be on there probably within the next 10 days or so. Also on Monday, this coming Monday, next week, we do anticipate a briefing on the current landscape of COVID treatments. Our clinical pharmacists, Amy Van Gorp and Randy Sales, have been working on a presentation that they'll be giving to our physicians on Monday. Immediately after that presentation, Randy and Amy will be joining me and Dr. Laird in presenting those treatments to the community, to you all. What's being recommended, what's being studied, what is not being recommended, and the reasons for that. So you can look forward to that discussion on Monday if you're interested. And so just wanted to give you a little bit of a heads up on that. This presentation on Monday leads me to some comments relative to supplemental or alternative treatments, and certainly we'll address in part, some things about, why does Orange City Health System always push the vaccinations? Why do they push the vaccine and never talk about treatments? Well, we do talk about our treatments, and we will talk about them extensively on Monday. And we quote unquote push the vaccine because we believe it's the best thing to do. We still recommend the vaccine. We respect and honor those that choose not to get that, but we still recommend the vaccine, and we think it serves itself in terms of the stats on the ground today, what we're seeing in the hospitals and how it protects us from being critically ill. But I want to talk a little bit more about these supplemental or alternative treatments. And certainly this is more than my personal position. And so when I talk about this, it's really we feel this way, but Orange City Area Health System does not have an issue or a problem, so to speak, with supplemental or alternative kinds of treatments. Well, what are they? Well, things like essential oils, vitamin regimens, acupuncture, other kinds of things. They all have a role of some kind for one's benefit. And so oftentimes our providers want to know those things because they do affect treatments. And so, but it's all meant to augment and supplement each other. What I do take issue with, though, is when these approaches replace the rather than augment the mainstream medicine. That's potentially very dangerous. So they all have a role. We're not opposed to that, but they should not replace entirely mainstream medical approaches. And so that's dangerous, and I do take issue with that approach. My second challenge or issue with that is when support for those supplemental or alternative approaches require disparaging mainstream providers or medical systems. Let these supplemental approaches stand for themselves and on their own merit. And please don't throw traditional approaches or traditional medicine, and more importantly, the people providing that care, the nurses, the doctors, the techs, under the bus simply to support your position of supplemental approaches. Again, everybody has the right to do that. Everybody certainly can do that. It's not inherently wrong by any means, but to support that, please don't throw the rest of the system under the bus. From the nursing home to the clinic, to the emergency room, to the hospital, our staff, quite honestly, is being tested right now. The last couple of weeks have been very challenging with both volume and intensity of things going on. They're holding up well, which is good news, and desire to be there for you and all of us whenever that moment of need might come. One of our core values at Orange City Area Health System is to avoid absolutes. This is something that not only serves us well in our corporate world, but can also serve us well in our personal lives as well. Words like always, all, never should be used very carefully, if ever. So this particular value or trait is important in our world today, certainly. Things are constantly evolving. You can find a study from legitimate sources that can prove 180-degree different positions. I was made aware of a study the other day that supported masking as an example from a very legitimate source. I also was made aware of another legitimate report that didn't support masking. So be very careful when you read studies or purport things, because most likely you can find something that talks the other side of the situation as well. I've talked a little bit before about being kind to one another, and to put it another way, seek first to understand, which, by the way, is another core principle at Orange City Area Health System. Someone recently relayed to me that it should be more than simple kindness and include empathy for others. Of course, grace would encompass all of this. The point is, as I've mentioned before, the collective burden of this COVID marathon that we're all participating in is manifesting itself in many different ways in virtually all aspects of our society. Most of all of our margins are very thin right now. It doesn't take a lot to push many of us over the edge, so to speak, or to say that unkind word, or to treat somebody in a way that we ourselves would not want to be treated. We need to be cognizant of those thin margins at this point. There is lots of stuff going on in our world today and locally as well. Sometimes I think we're forgetting that the life exists out there other than dealing with COVID. Part of our challenge as we move forward is learning to live with COVID. And so for the moment, at least as we continue on through hopefully, we said this before, the latter stages of this COVID marathon, that we keep some of these things in mind and suggest that perhaps you take a little time, extra time, to take a break, to do something fun, to lighten up, go for a walk. We all need that now, perhaps more than ever. Well, that's it for me today. Thank you for joining us. Please remember to consider watching those videos next week. The first one on Monday dealing with COVID treatments, and the second one coming up in the near future relative to blood sugars and keeping your engine tuned in that regard. Thank you for joining us. Be kind to one another and extend grace whenever possible. Thank you again for joining us.